bill.
I'd like to thank my friend from Georgia, and I'll try to be brief. I guess to say that we need to do health care reform, I think that is pretty obvious to a lot of people. The inflationary increases in the private sector to businesses, particularly in the health care area, is unsustainable. A lot of individuals who are having to pay for their own health care cost are getting double-digit increases in premiums. In the public sector, the Medicare and Medicaid programs are just unsustainable. Medicare alone is $38 trillion underfunded. Over the next 75 years, we've promised benefits to the baby boom generation and current retirees, and we're $38 trillion short of being able to honor those benefits. What has happened? You've created a government program everyone likes, respects, and is trying to save, and actuarially, it is not going to make it unless we reform it. So what have we done? In the name of health care reform, we've taken a program that many senior citizens rely upon, all senior citizens practically. We've reduced the amount of money we're going to spend on that program and give the money from Medicare to create another program that the government will eventually run, and it makes no sense. We need to look at saving Medicare from impending bankruptcy. Why would you reduce Medicare by $464 billion, take the money out of Medicare that's already financially in trouble to create a new program? Well, it makes no sense to me. That's not what we're trying to do, from my point of view, to reform health care. Now, Medicare cuts that Senator Chambliss was talking about, they're real. The way our Democratic colleagues and friends try to get to revenue neutrality on the additional spending to get it down to where it doesn't score in a deficit format is they take $464 billion out of Medicare to offset the spending that is required by their bill. Now, here's the question for the country. How many people in America really believe that this Congress or any other Congress is actually going to reduce Medicare spending by $464 billion over 10 years? I would argue that if you believe that, you should not be driving. There is absolutely no history to justify that conclusion. In the 111th Congress, there were 200 bills proposed, and I was probably on some of them, to increase the amount of payments to Medicare. In 1997, we passed a balanced budget agreement when President Clinton was president, slowing down the growth rate of Medicare. That worked fine for a while until doctors started complaining, along with hospitals, about the revenue reductions. Every year since about 1999, 2000, we have been forgiving the reductions that were due under the balanced budget agreement because none of us want to go back to our doctors and say that we're going to honor those cuts that we created in 1997 because it's creating a burden on our doctors. Will that happen in the future? You better believe it will happen in the future. In 2007, Senator Cornyn and Gregg introduced an amendment to reduce Medicare spending by $33.8 billion under the reconciliation instructions. It got 23 votes. I remember not long ago, the Republican majority proposed reducing Medicare by $10 billion. Not one member of the Democratic Senate voted for that reduction. They had to fly the vice president back from Pakistan to break a tie. Over $10 billion. So my argument is quite simple to the American people. We're not going to reduce Medicare by $464 billion. And if we don't do that, the bill is not paid for. And that creates a problem of monumental proportions. If we did reduce Medicare by $464 billion and took the money out of Medicare to create another government program, we have done a very dishonest thing to seniors. We're damned if we do and we're damned if we don't. And during the whole campaign, I don't remember anybody suggesting that you needed to cut Medicare to create health care reform for non-Medicare services. But that's exactly what we're doing. Now, to my Democratic colleagues, there'll come a day when Republicans and Democrats are going to have to sit down and seriously deal with the underfunding of Medicare, with the impending bankruptcy of Medicare. Everything that we're doing in this bill may make sense to save Medicare from bankruptcy. It doesn't make sense to pay for another government-run health care program outside of Medicare. It makes no sense to take the savings that we're trying to find in Medicare and not use them to save Medicare from what I think is going to be a budget disaster. So let it be said that this attempt to pay for health care, to make it revenue neutral, will require the Congress to do something with Medicare that it's never done before and is not going to do in the future. So the whole concept is going to fall like a house of cards. The way we've tried to pay for this bill has got so many gimmicks in it, it would make an Enron accountant blush. Now, as to tort reform, quite frankly, I used to practice law and did mostly plaintiff's work. I am not a big fan of Washington taking over state legal systems. I prefer to let states do what they're best at doing and let the federal government do a few things well, and we're doing a lot of things poorly. But if we're going to take over the entire health care system, if that's going to be the option available to us, then we also need to nationalize the way we deal with lawsuits. And to the AMA, there'll come a day, if we keep going down the road here, of where the national federal government will determine how you get to be a doctor. And there will be no state medical societies. And we'll have a national system to police doctors. That's what's coming if we continue to nationalize health care. So with Senator Chambliss, I've tried to come up with a more reasoned approach when it comes to legal reform. I've always believed that people deserve their day in court, and there's no better way to resolve a dispute than have a jury do it. I'd rather have a jury of independent-minded citizens decide a case than a bunch of politicians or any special interest group. So the jury trial to me is a sacrosanct concept to serve this country well. But one thing I've always been perplexed about in America is that the risk of suing somebody is very one-sided. Most developed nations have a loser pay rule. I think you should have your day in court, but there ought to be a downside to bringing another person into the legal system. So a loser pay rule, I think, will do more to modify behavior than any attempt to cap damages. Let both wallets be on the table. You can have your day in court, but if you lose, you're going to have to pay some of the other side's legal cost, which will make you think twice. Now, as to the indigent person, most people who sue each other are not indigent. The judge would have the ability to modify the consequences of a loser pay rule, but we need to know going in that both wallets are on the table. And under our proposal, we have mandatory arbitration where the doctor and the patient will submit their case, the case, to an arbitration panel. And if either side turns down the recommendation of the panel, they can go to court, but then the loser pay rule kicks in. I think that will do more to weed out frivolous lawsuits than arbitrarily capping what the case may be worth in the eyes of a jury. I think it really does create a financial incentive not to bring frivolous lawsuits that does not exist today. If you have a $500,000 damage cap, most of the people I know say, I'll take the $500,000. That's not much of a deterrent. But if you told someone, you can bring this suit, the arbitration didn't go your way, but if you go into court after arbitration, you risk some of your financial assets, people think twice. So I think that's why this is a good idea. The National Chamber of Commerce has endorsed it, and I'm proud of the fact that they have endorsed it. I'd rather not go down this road, but if we're going to nationalize health care, we also need to do something about a legal system that's going to be affected by the nationalization of health care. The final comment I'd like to make about what we're doing here is that it's probably worrisome to people at home that we're about to change 1/6 of the economy and you can't find one Republican vote to help. Now, I guess there's two ways to look at that. It's the problem of the Republican Party, or maybe the bill is structured in a way that is so extreme there is no middle to it. And I would argue that what we have done here is that we've abandoned the middle for the extreme. It's pretty extreme, in my view, to take a program that's $38 trillion underfunded, cut it, and take the money to create a new program rather than saving the one that's in trouble. It's pretty extreme, in my view, to take a country that is so far in debt you can't see the future and add $2.5 trillion of more debt onto a nation that's already debt-laden in the name of reforming health care. When you look at the second 10-year window of this bill, it adds $2.5 trillion to the national debt. Is that necessary to reform health care? Do we need any more money spent on health care, or should we just take what we spend and spend it more wisely? The first 10 years is a complete gimmick. What we do in the first 10 years of this bill is collect the $500 billion in taxes for the 10-year period, and we don't pay any benefits until the first 4 years are gone. Now that is just not fair. That's a gimmick. And that catches up with you in the second 10-year period. So the reason we don't have any bipartisan support is because we've come up with a concept that has no middle to it. This is a power grab by the federal government. This is a chance to set in motion a single-payer health care plan that the most liberal members of the House and the Senate have been dreaming for. This is a liberal bill written by and for liberals, and it's not going to get any moderate support on the Republican side, and there is some over here to be had, and they're going to have a hard time convincing those red state Democrats that this is good public policy. So that's where we find ourselves, trying to change 1/6 of the economy in a way that you don't have any hope of bringing people together. So I would argue we should stop and start over. I want to thank my good friend from Georgia for trying to find a way to change lawsuit abuse in a more reasoned fashion.
Well, I thank my colleague from South Carolina, Senator Graham, for his really thoughtful process that we went through in thinking through the loser pays bill and the amendment that we have filed here. And just like you, having practiced law for 26 years before I was elected to the House, the same year you were, and then we were elected over here, I tried plaintiff's cases as well as defendant's cases. Never represented a defendant in a malpractice case. I was always on the other side. And I have great sympathy for individuals who are wronged by a physician who is negligent. And you and I agree that anybody who is the victim of negligent action ought to have their day in court. And that's what we provide for under our bill. There is absolutely no question about the fact that anybody who is subject to negligent acts on the part of a physician, that they can have their day in court, and they should have their day in court if that's what they decide they want to do. But under a loser pays provision like we have designed here, we can eliminate, hopefully, the frivolous lawsuits that add significantly to the cost of health care delivery in this country. In 2003, direct tort litigation costs in America accounted for 2.2% of our GDP. That's double the percentage of Canada, Great Britain, Germany, France, and Australia, all of which have loser pay systems. The state of Alaska has had a loser pay system since 1884. And tort claims in the state of Alaska constitute a smaller percentage of total litigation than the national average. Florida, which applied a loser pays rule to medical malpractice suits from 1981 to 1985, saw 54% of their plaintiffs drop their suits voluntarily. It does make a difference on frivolous suits. In the state of Florida, during that same period of time, the jury awards for plaintiffs rose significantly. And just as in our situation, anybody who had a legitimate case in Florida during that period of time had the right to have their case adjudicated by a jury. Those that made a decision to do so received more significant awards. And that's the way the system ought to work. This is a win-win situation for the cost of health care delivery. It's a benefit to the physicians, sure, because they eliminate part of their significant cost of delivering health care services, but it also is a huge benefit to those individuals in America who are subject to negligent acts on the part of physicians. I would, Mr. President, ask unanimous consent that a letter to Senator Graham and myself from Bruce Jostin at the U.S. Chamber of Commerce dated November the 3rd, 2009 be submitted for the record.
Without objection.
And with that, I would yield the floor.
Senator from Illinois.
Mr. President, could the chair inform me of how much time was used on the Republican side during the last group of speakers?
42 minutes and 14 seconds.
I thank the chair, and I'm going to proceed to speak in the same manner and yield to Senator from Vermont, and our time will be less than that in total. So I see the senator from Louisiana is here, so we're going to be speaking less than 42 minutes. We guarantee you that much, and we're going to follow the same process, if there's no objection, that was just followed, where 3 Republican speakers spoke in that 42-minute period of time. And I ask unanimous consent that Senator Sanders be recognized after me to speak, and that our total time be no more than 42 minutes.
Is there objection? Objection was heard.
Well, Mr. President, I just offered that to the Republican side, and they asked me for permission, and I gave permission, unanimous consent. So we'll speak as long as we'd like, and we'll enter into a colloquy. I hope that Senator from Louisiana will reconsider. Let me try to address a few of the issues that have been raised here on the floor. First, on the issue of medical malpractice. This is an issue often brought up on the other side of the aisle. The first thing I would like to say is, this is the bill we are debating. It's 2,074 pages, and one extra page makes it 2,075 pages. It's taken us a year to put this together. There have been a series of committee hearings that have led to the creation of this legislation, and it has been posted on the website for anyone interested. If they go to Google, for example, and put Senate Democrats in, they'll be led to a website which will let you read every word of this bill. It's now been out there for 12 days at least, and it will continue to be there for review by anyone interested. If you then Google Senate Republicans and go to their website on health care and look for the Senate Republican health care reform bill, you will find this bill, the Democratic bill, because there is no Senate Republican health care bill. For a year, and with an enormous number of speeches, they've come to the floor and talked about health care, but have never sat down and prepared a bill to deal with the health care system, which leads us to several conclusions. This is hard work, and they haven't engaged in that hard work. It is easier to be critical of this work product, and they have chosen that route. That's their right to do. This is a Senate. We are the majority party. We are trying to move through a bill. But all of the ideas they've talked about tonight and other evenings have not resulted in a bill. Secondly, it may be that they don't want to see a change in the current system. They are happy with the health care system as it exists today. That is possible. In fact, I think it drives some of them to the point where they criticize our bill but don't want to change the system because they like it. I guess there's some things to like about it. There are good hospitals and doctors in America. Some people are doing very well under the current system, but we also know there's some big problems. We know the current system's not affordable. We know that the cost of health insurance has gone up 131% in the last 10 years, that 10 years ago, a family of four paid about $6,000 a year for health insurance. Now that's up to $12,000 a year, and that we anticipate in 8 years or so that it'll be up to $24,000 a year. Roughly 40% or more of a person's gross income will be paid in health insurance. That is absolutely unsustainable. So businesses are unable to offer health insurance, as well as individuals are unable to buy health insurance. The Republicans have not proposed anything, nothing, that will make health insurance more affordable. This bill addresses that issue. They have nothing. Secondly, we know that there are about 50 million Americans without health insurance. These are people who work for businesses that can't afford to offer a benefits package. There are people who are recently unemployed, and there are people in such low-income categories they can't afford to buy their own health insurance, and their children, 50 million. This bill that we have before us will give coverage to 94% of the people in America, the largest percentage of people insured in the history of our country. The Republicans have failed to produce a bill that expands coverage for anyone in America. Under the Republican approach, nothing would be done to help the 50 million uninsured. The third issue is one about health insurance companies. Everybody has an experience there, and it's unfortunately not good for most. Because when you paid premiums all your life and then need the health insurance, many times it's not there. What we do is to give consumers bargaining power and a fighting chance with health insurance. That, to me, is a reasonable approach. It eliminates discrimination against people because of pre-existing condition, putting caps on the amount of money that's being paid. We extend the coverage for children under family health plans from age 24 to age 26. We do things that give people peace of mind that when they really need health insurance for themselves and their family, it will be there. The Republicans have failed to offer anything that deals with health insurance reform. That's a fact. They've said a lot about Medicare. I would like to tell you that tomorrow or soon, I will be co-sponsoring, and Senator Bennett of Colorado will be offering an amendment which couldn't be clearer on the issue of this bill and the Medicare program. The amendment is so short and brief and direct and understandable, I want to read a couple highlights. Senator Bennett's amendment says, nothing in the provisions of or amendments made by this act, the Health Care Reform Act, shall result in the reduction of guaranteed benefits under Title 18 of the Social Security Act. I want to make it clear that's Medicare. And what Senator Bennett is saying is that people will have their Medicare benefits guaranteed. Nothing in this bill will infringe on their Medicare benefits, despite everything that's been said. The Bennett amendment, which will be offered, goes on to say savings generated for the Medicare program under Title 18 of the Social Security Act, under the provisions of and amendments made by this act, Health Care Reform, shall extend the solvency of Medicare trust funds, reduce Medicare premiums and other cost sharing for beneficiaries, and improve or expand guaranteed Medicare benefits and protect access to Medicare providers. All of the speeches made over the last 3 days about how this bill threatens Medicare, it does not, will be completely cleared up by this Bennett amendment. I hope some of the Republicans who have a newfound love of the Medicare program, which we started many years ago, will join us in voting for this amendment. It would be great to see if their speeches to save Medicare will result in their votes for Senator Michael Bennett's of Colorado's amendment. This is a critically important amendment. I commend him for being so straightforward and showing real leadership on an issue of this magnitude. I would like to, I know that the senator from Vermont is interested in speaking, and I'm prepared to yield to him for comments and questions, but before we do, I would like to say, by way of introduction, that we just heard one of our Republican colleagues say that this is a single-payer bill, that at the end of the day we will have created a single-payer system. I think the senator from Vermont is familiar with the concept of single-payer, and I would invite his comments or questions through the chair to me about his feelings on this issue.
Well, I thank my friend from Illinois for asking that question, because coincidentally, we have just introduced and brought to the desk legislation for a single-payer national health care program. And I would suggest to my friend from Illinois and my Republican friends that it is a very different bill than the legislation that we are now looking at. In no way, shape, or form is the legislation being debated now a single-payer national health care program. And as my friend from Illinois understands it, I would ask his views on this. You know, I have heard some of our Republican friends talk about how strong this current health care system is that we have right now. And I would ask my friend from Illinois, do you think we can do better than being the only major country in the industrialized world that does not guarantee health care to all of its people? Can we do better than that?
In response to Senator from Vermont, we must do better. This is the only civilized, developed, industrialized country in the world where a person can literally die because they don't have health insurance. 45,000 people a year die because they don't have health insurance. What does it mean? Well, one illustration. If you had a $5,000 copay on your health insurance policy, and people face that, and you go to the doctor, and the doctor says, Durbin, we think you need a colonoscopy, and I realize that I have to pay the first $5,000, and a colonoscopy is going to cost $3,000, and I say, I'm going to skip it, which people do, and bad things happen. I develop colon cancer and die. My insurance has just failed me. Basic preventive care is not there. We are the only country, civilized, developed country, where that is a fact.
And I would ask my friend from Illinois, has he talked to physicians who have, just on that issue, told them that they have lost patients who walked into their office and they say, why didn't you come in here 6 months ago or a year ago? And that patient said, well, you know, I didn't have any money, and I thought maybe the pain in my stomach or my chest would get better. Now, I've had that conversation with physicians in Vermont. I wonder if you've talked to physicians who have said the same thing.
I'd say to the senator from Vermont, a lady that I met 2 weeks ago in southern Illinois, 60 years old, a hostess at a hotel who serves breakfast in the morning. We know they're there as we travel around our states, has never had health insurance in her life, is diabetic, and told me that her income was so low, it's $12,000 a year, she couldn't afford to go to a physician to check out some lumps which she had discovered. I mean, that is the reality of the current health care system in the wealthiest, greatest nation on earth.
And when, if I may say to my friend from Illinois, we have heard discussions of quote-unquote death panels. Well, I think you might agree with me that when we talk about death panels, we're talking in reality about 45,000 people who die every single year because they don't get to a doctor on time. That seems to me to be what a death panel is. And in the midst of all this, with 46 million uninsured, with 45,000 people dying every year because they don't get to a doctor when they should, when premiums have doubled in the last 9 years, when we have almost 1 million Americans going bankrupt because of medically related bills, I would ask my friend from Illinois, isn't it time for a change? And isn't it time that this country now moves forward and provides health care to all of our people in a comprehensive and cost-effective way?
I'd say to the senator from Vermont through the chair that I certainly agree with him. I'd add one more statistic to what he just said. Of the nearly 1 million people filing for bankruptcy in America each year because of health care costs, medical bills they can't pay, 3/4 of them have health insurance.
Right.
3/4 of them were paying premiums. These were the people who were turned down when they needed coverage. These are the people who ran into caps on coverage on their policies. These are folks who had to battle it out and lost the battle with the insurance companies to try to get life-saving drugs. That is the reality of the current system. And the fact is, the Republican side of the aisle has not produced an alternative. We have worked long and hard to do it. They have not.
And I would ask my friend from Illinois, if we are not just dealing, not just with a personal health care issue of 46 million uninsured and people dying, but are we not dealing with a major economic issue? How are businesses in this country going to compete with the rest of the world when every single year they're seeing huge increases in their health insurance? Rather than investing in the business that they're supposed to be in, they're having to spend enormous sums of money as health care costs soar in this country. Now, I know small businesses in Vermont tell me that in some cases not only can they not provide health insurance to their workers, they can't even provide it for themselves. I got to believe this is a similar situation in Illinois, is it not?
It is. In response to the senator from Vermont through the chair, we're sent many books, and some of them I had a chance to glance at. This is the recent one I received called Bend the Healthcare Trend, and they have here information which says American healthcare spending reached $2.4 trillion in 2008 and will exceed $4 trillion by 2018. We know that we expect a doubling of basic health insurance premiums in 8 to 10 years, and we know what you just described as reality, that even businesses owned by a couple, husband and wife, are finding themselves not only unable to provide health insurance for their employees because of its cost, they can't cover themselves.
Exactly.
I had a friend of mine, one of my boyhood friends, and grew up with him and his wife, and his small business had one of their employees who under the health insurance plan his wife had a baby with a serious illness. As a result of it, their premiums went through the roof, and he had to cancel his group health insurance. He gave his employees the $300 a month, whatever it was he was paying, and said, we're all on our own now. We have to go in the private market. The couple with the sick baby couldn't find any health insurance. My friend, who is in his 60s, he and his wife are in a pitch battle every year about how much they have to pay for health insurance. And the company, the only one that will cover them, each year excludes whatever they turned a claim in for last year. So that is the reality of health insurance for small businesses. I also want to tell my friend from Vermont that about 1/3 of all realtors in America are uninsured, have no health insurance. They are independent contractors and they have no health insurance, 1 out of 3.
And while we're talking about the economics of health care in this country, I wonder if my friend from Illinois has had the same experience that I've had in Vermont, where people tell me they're staying on their job not because they want to stay on their job, but because the job is providing decent health insurance and they can't go where they want to go because the new job may not, or they're afraid about the interval when they may not have any health insurance at all. And I wonder if my friend from Illinois happened to see the piece in the paper, unbelievable, where a guy joined, a middle-aged fellow, joined the United States military. Do you know why he joined the United States military? His wife was suffering from cancer and he couldn't find a way to get health care for her, so he joined the military. Do you think that this is what should be going on in the greatest country in the world?
We could do better. And I would say to those who call our plan a single-payer plan, what we're trying to do is to get fair treatment from private health insurance companies for consumers and families across America, and to give them choices. The senator from Vermont, I assume, is part of the Federal Employees Health Benefit Program. So am I. And most members of Congress belong to this program. 8 million federal employees and members of Congress are part of this program. It may be the best health insurance in America because we can shop. I just got a notice in the mail that says open enrollment coming. If you don't like the way you were treated by your health insurance plan last year, you can change. Pick a different plan. If it's a generous plan, more money will be taken out of your check. If it's not, less money will be taken out. We can shop. What we do on the insurance exchanges in this bill is say to these Americans who wouldn't otherwise have options, go shopping. Find the best health insurance plan for your family. Exercise your choice. And I would say to Senator Harry Reid, who drafted this bill, I thank him for his hard work, he includes a public option, a not-for-profit health insurance plan with lower costs that people can choose if they care to. Giving people that choice giving them an option to go shopping for the most affordable, best health insurance plan is what we enjoy as members of Congress and what every American family should.
I'd ask my friend from Illinois, and this is kind of an awkward way to communicate with the chair here and the American people, but that's what we're obliged to do, yeah. But I would ask my friend from Illinois, why do you think some of our Republican friends feel so threatened and so upset by giving the American people the option to choose a public Medicare-type plan as opposed to a private insurance plan? Do you think that maybe, just maybe, some of our friends are more interested in representing the interests of the big private insurance companies rather than the needs of the American people?
I'd say to my colleague from the state of Vermont in response to the chair, I'm waiting for the first Republican senator to offer an amendment to this bill to abolish Medicare. If they really believe that government health insurance is such a bad idea, they ought to step right up and show it.
Well, I would say to my friend from Illinois that that's an interesting proposal, and in fact, I was almost thinking of offering an amendment at one point, because, you know, we have a lot of people in this country who stand up and say, get the government out of health care. Well, I think that some of my Republican friends have kind of echoed that message. And I do think that the senator from Illinois is right. We may bring forth an amendment to allow our Republican friends to say, let's abolish the Veterans Administration. Because, as you know, that is a government-run program, which most veterans in my state, and I think around this country, are very proud of. They think it's a good program. And what the statistics tell us, it is a very cost-effective way to provide quality health care to all of our people, all of our veterans. So maybe we should bring forward an amendment to those who say, get the government out of health care. You want to abolish the Veterans Administration? Go for it. And what about TRICARE? Maybe you want to abolish TRICARE. Go for it. Maybe you want to abolish the S-CHIP program, which is providing high-quality health insurance for millions of kids in this country. So maybe I would say to my friend from Illinois, who might work together, bring forward an amendment. Let our Republican friends who say get the government out of health care, let them abolish the Veterans Administration, Medicare, S-CHIP, Medicaid. Let them do that. And we'll see how many votes they might get.
I would say to the senator from Vermont, there's another way that senators who loathe the idea of government-run health insurance plans can show personally their commitment to that idea by coming to the floor and publicly announcing they will not participate in the Federal Employees Health Benefit Program, which provides health insurance for members of Congress. I have yet to hear the first member critical of government health plans come forward and say, so in a show of unity and personal commitment, I am going to opt out.
Well, I would suggest to my friend from Illinois that we could take it even another step further. I go to the Capitol Physician's office right here. That's where I go. We pay extra money for it. I have Blue Cross Blue Shield, but I go to there. You know who runs the Capitol Physician's office, which I suspect the vast majority of the members of Congress go and get very fine primary health care? Well, it's that terrible government agency, the United States Navy. So maybe some of our friends who are busy denouncing government health care might want to say they don't want to take advantage of that very fine, high-quality health care. And that speaks for the whole military as well. While we're at it, maybe we should abolish health care for the United States military, which is all government-run and, by the way, generally regarded as pretty good quality health care. I would ask my friend his views on that.
Well, I don't think you're going to hear that. I think you'll hear a lot of speeches about socialized medicine, socialism, and the big reach of government. But when it comes right down to it, there's not been a single member from the other side who stepped up and said, and therefore I'll offer an amendment to abolish it. They'll have their chance in this bill, and if they want to, they can. I don't think the people who have this coverage today would like to see it gone.
Well, it might be an interesting amendment, I would say to my friend. And there's another area where it's a semi-government, nonprofit, which I know you, the senator from Illinois, feels very strongly about. And that is the Federal Qualified Community Health Center, begun by Senator Kennedy over 40 years ago. We now have over 1,200 community health centers all over this country. And in fact, I know that this is widely supported in a bipartisan or tripartisan way because the federally qualified community health centers provide quality health care and dental care and low-cost prescription drugs and mental health counseling. And I might say to my friend from Illinois that one of the provisions in that 2,000-page bill that you're holding up is legislation that you and I and others have worked hard on, is to substantially expand the community health center program into every underserved area in America. We talk about 46 million people being uninsured in this country. We got 60 million people who don't have access to a doctor on a regular basis. And if we expand the community health center program, if we expand to a significant degree the National Health Service Corps, so that we can help young people become primary health care physicians by paying off their very substantial medical debt, would my friend agree with me that this would be a major step forward in improving primary health care in America?
Senator from Vermont has been a leader on this issue. I can recall when President Obama came forward with his stimulus bill, the Reinvestment and Recovery Bill, that the senator from Vermont was one of the leaders to put additional funds in this bill to build clinics all across America. In rural areas we represent, in the towns and cities that we represent as well, for the very reason you mentioned, because for a lot of people that I represent in downstate Southern Illinois and some of the rural reaches, it's a long drive for a doctor's clinic or primary care. So these community health clinics, FHQA clinics, are going to offer people primary care. I think as a result of this bill, when we enact it, and I feel very good about the enactment of this because I think we sense this is a moment in history we shouldn't miss, we are going to see this network grow across America, and it has proven itself to be so good. In the city of Chicago, I visit these community health clinics, I'll bet you do in Vermont, and what I find there, many times I'll walk in the door, the administrator will be there, we'll start talking, I'll meet the doctors, I'll meet the nurses, and when I finally get a chance, drink a cup of coffee and talk to them for a few minutes, I say, and I mean it, if I were sick, I would feel confident walking in the front door of this clinic that I'd be in the best of hands, better than the most expensive clinic in my state.
And my friend from Illinois makes the point, and I have visited virtually all of them in the state of Vermont. We've gone from 2 to 8 with 40 satellites. We have over 100,000 people in the state of Vermont who now use these federally qualified health centers. And I know that my friend from Illinois is also aware that when we talk about health care, you got to talk about dental care.
Yes.
Because if what is true in Vermont is true in Illinois, you're going to have a whole lot of people who don't have access to a dentist, which these federally qualified health centers now provide, and mental health counseling, and low-cost prescription drugs. So I think, my friend from Illinois, I'm sure you and I are going to work together to make sure that we, in fact, are successful in keeping people out of the emergency room, keeping them out of the hospital, by enabling them to get the medical care they need when they need it. And I would look forward to working with my friend on that.
I might say the senator from Vermont has also raised an important issue. We know we're going to need more primary physicians, primary care physicians. And so there are provisions in this bill to encourage young people to pursue primary care, internists, family practitioners, because those are the frontline people that are needed more frequently for preventive care and basic checkups, so that people have a chance to see a good doctor before they get sick, right, or become seriously ill and are much more expensive. So we are pushing forward for more and more healthcare professionals. Again, the Republican critics of this legislation have offered nothing when it comes to encouraging the growth of our healthcare workers in America. This ought to be something that's nonpartisan. I mean, I would think that at some point they would agree that many things in here are essential for the future of our country, and I think that's one of them.
And would my friend from Illinois agree that it doesn't make a whole lot of sense for people who do not have health insurance today to go into an emergency room, run up a huge cost, or to get terribly ill because they don't go to the doctor when they should and end up in the hospital? Wouldn't it make a lot more sense, both from the personal health of the individual and saving money for the system, to provide health care to people when they need it?
I agree with the senator from Vermont, and I would say we have some of the best health care in America, but also the most expensive health care in America, spend more per person than any other nation on earth, and a lot of it has to do with money not being well spent. And people who do not have access to a medical home, which we established in this bill, do not have access to a community health care clinic, in desperation will take a baby with a high fever into an emergency room. Right. They will wait for hours to finally see a doctor, and once there, they'll have the most expensive care they could ever face, when they could have gone for a doctor's appointment. Exactly. And been taken care of at a fraction of the cost. That isn't good for the hospital, because many of them are giving charity care that they don't get compensated for, and they pass that cost along to other patients, and it certainly isn't good for the family that's involved.
Well, at this point, let me thank my friend from Illinois for allowing me to engage in this colloquy with him. and I'm going to yield back the floor to him and thank him for his very good work.
I thank the senator from Vermont, and I would just say that at this point in time, we have 3 or 4 amendments before the Senate on health care reform. We started the debate on Monday. We are now wrapping up Wednesday. We're about to go into the 4th day of the debate on one of the most important bills in the history of the United States Senate, and we have yet to reach an agreement with the Republican side of the aisle to have the amendments voted on. If we are only doing 4 amendments or 3 amendments in 4 days, this is not going to be the kind of debate the American people expected. They expected us to bring issues before the floor here, debate them, reasonable period of time, vote, move to another issue. There's certainly a lot of things to talk about. And so I hope that the Republican side of the aisle will have a change of heart and will start to join us in this dialogue, will offer their amendments in a timely fashion. We will give them their opportunity to debate them and then bring them to a vote. But the fact is, we've not had a single vote this week on health care reform amendments because of objections from the other side. That is not in the interest of moving forward this important legislation and giving members an opportunity to present their amendments and have them voted on in a timely fashion. And Mr. President, I yield the floor.